Orthodontics is a big commitment and things can quickly go wrong. This second video aims to explain to you what some of the common risks of orthodontic treatment are and to educate you further about your role in obtaining a successful outcome. Your own individual treatment plan and any risks associated with that will be discussed with you by your own orthodontist, and during this appointment you'd also have an opportunity to ask them any questions that you may have. The reason why cleaning and not snacking on sugary foods and drinks is so important is because braces will trap foods and sugars around the teeth. Early tooth decay, also known as decalcification, therefore can start to occur if the teeth are not cleaned properly. These white and brown marks are permanent and do not come off at the end of treatment. If your orthodontist notices at any point that you are developing these marks, you will be immediately advised of this and warned that the orthodontic appliance might need to be removed and treatment stopped if your cleaning or diet does not improve. Poor oral hygiene can also result in inflammation of the gums occurring, and your gums may start to bleed when you brush them. This can easily be reversed by improving your cleaning frequency and technique. Gum recession can occur during treatment, either due to poor oral hygiene or if it becomes apparent that the bone covering a tooth root is very thin. If you notice any recession occurring, you must immediately inform your orthodontist. Shortening of the roots of apparently healthy teeth occurs in most patients undergoing orthodontic treatment. On average, this is around 1 to 2 mm and has no impact on the tooth. However, more significant root shortening can also occur, and it's more likely to occur if you've had previous trauma, have already thin or short roots to begin with, or you know of other family members who have experienced root shortening during brace treatment too. However, sometimes none of these risk factors are present and significant root shortening can still occur. Although this is very rare, this can affect the longevity of the tooth affected. If you have experienced previous trauma to a tooth, or a tooth is already heavily filled, there's a greater risk of you experiencing problem with this tooth, such as non-movement or the tooth losing vitality during treatment. If this occurs, you might need to have some dental treatment done, and we may need to re-evaluate our treatment aims, stop treatment, or at least take a break in the treatment to allow the tooth to heal. Small gaps between the teeth next to the gums might be noticed once your teeth are straight, and these are known as black triangles. These are more common in adults and when the teeth were previously crossed over to start with. The risk of experiencing a fracture of the outer surface of the tooth when a metal brace is removed is very low, but there's a slightly higher risk for ceramic braces. If the tooth has a filling on it, sometimes this may break also when the brace is removed, but this is very rare. Very rarely we have to remove braces before treatment is complete. This is normally because either the patient's damaging the teeth and gums through poor cleaning, diet, or treatment isn't progressing if the patient isn't complying with instructions, appointments are being missed, or there's been frequent breakages. If treatment is discontinued early, then your teeth may be worse than before you started. Orthodontics is a treatment that you have chosen to have. This is why you've been asked to watch these videos, so that you can consider carefully what is expected of you during brace treatment and that you're happy to agree to this treatment. It is important that you understand the need for lifelong retention after treatment, and you will be provided with retainers once the active phase of your treatment is completed. It is recommended that you watch the Hold That Smile video, which has been produced by the British Orthodontic Society and is available on their YouTube channel and website. You should expect to wear your retainers every night and for as long as you want to keep your teeth straight. Like everything in life, the retainers will eventually need replacing, and this will involve a financial cost. As you can see, orthodontic treatment is a big commitment. As with any medical treatment, there are risks involved, but these are small as long as you're willing to comply with instructions and look after your oral health and brace. The advantages of treatment are that you get a great smile at the end, but this is only possible if you're willing to commit to your responsibilities. Hopefully by now, you're feeling more informed about what potential orthodontic treatment will involve. The next step is to discuss your individual treatment plan with your orthodontist, and you'll have an opportunity to ask any questions you may have during this appointment.